Hello, my name is Ishida. I am from Kurume University Hospital in Japan. I specialize in endoscopy, especially in ERCP and EOS. In this video, I am going to discuss the reason for studying bile ducts using a magnifying endoscope, the methodology of my study, and briefly discuss the results. First, I'll talk about the reason for this study of magnifying endoscopic observation of non-neoplastic bile duct mucosa with NBI. There have been a number of studies describing the utility of paroral cholangioscopy since a new video POCS was developed with NBI. However, endoscopic findings of bile duct mucosa have not been established yet. POCS has an advantage in determining whether the observed mucosa is cancerous or not. But we have not precisely identified endoscopic features of even non-neoplastic mucosa. So I studied this study with just non-neoplastic mucosa to reveal endoscopic finding of bile duct mucosa based on histopathology, excluding neoplasm. Next, I want to briefly describe the methodology. 25 fresh common bile ducts which were surgically resected were eligible for this study. First, I cut each common bile duct open for endoscopic observation its mucosa. I observed the bile duct mucosa with a magnifying endoscope, which is commonly used for the gastrointestinal tract, and I utilized both conventional white light imaging and NBI. After histological diagnosis, 25 specimens were classified into 3 categories according to the degree of histological inflammation: normal, mild inflammation, and severe inflammation. Then I examined the relationship between the magnifying endoscopic findings and the microscopic histopathology. So now I'd like to discuss an overview of this study. Normal mucosa has oval-shaped diffuse areas and a fine regular network of microvessels. These oval-shaped diffuse areas were named dimple signs in a previous report by Dr. Itoi. Both dimple signs and a fine regular network of microvessels are the characteristic features of normal bile duct mucosa. On the other hand, in mild inflammation mucosa, we could not clearly see these oval-shaped diffuse areas, nor could we clearly see the network. This result suggests that inflammation obscures these features. In severe inflammation mucosa, dimple signs and a fine regular network of microvessels disappear, and various types of microvessels and mucosa structures can be seen. For example, petechial hemorrhage, scales, cobblestones, or Bile structures. In all cases, we could see these findings more clearly when magnifying endoscopy with NBI was used. To summarize, there are 3 things to consider. First, oval-shaped diffuse areas or dimple signs and a fine regular network of microvessels are the characteristic features of normal bile duct mucosa. Second, inflammation obscures these features. Third, bile duct mucosa with severe inflammation reveals various types of mucosa structures. This study indicates that differences between non-neoplastic mucosa inflammation can be identified using magnifying endoscope. However, some types of severe inflammation mucosa appear similar to cancerous mucosa when using a magnifying endoscope. Because it's very difficult to distinguish between them, even when using current cholangioscopy, I recommend that biopsy be performed in cases of suspected neoplasm.